The Senate rejected separate health care bills from Republicans and Democrats yesterday as Americans face a steep rise in premium costs at the beginning of next year. And lawmakers voted on two partisan bills that they knew would fail: the Democratic bill to extend what's already there, the Affordable Care Act subsidies, and a Republican alternative that would have created new health savings accounts. Joining us now, MS Now medical analyst Dr. Vin Gupta. It seems more than likely these ACA subsidies are going to expire. Why didn't they go with the Republican plan? I'd like to know what was wrong with it.
Sure, yeah.
And what's going to happen?
Well, the Republican plan focuses a lot on sending checks to Americans. And it sounds good on its surface. Let's send everybody $2,000 and they're going to make...
they'll be fine.
They'll be fine. The problem is health savings accounts where they're hoping that $2,000 will be redirected towards. If you're making less than $100,000 a year, which is generally the demographic that's taking advantage of Obamacare and these extended premium tax cuts, that demographic needs $2,000 for basic life expenses. They're not going to invest it in a health savings account, which is why people who make $200,000 and more are the ones that actually utilize health savings accounts. It's tax sheltered. It's actually an investment vehicle. It's not a good way to provide people affordable health care coverage. So that was always a farce. Unfortunately, that is not a plan, and that cannot substitute for extending these subsidies, unfortunately.
So let's take this down to the ground level. And you're practicing medicine. If, in fact, these subsidies expire on New Year's Eve, if the Congress doesn't come up with some kind of alternative to at least bolster a little bit the care that people are getting, what happens to not only prices, which will go up, obviously, but to the care that people are able to get?
Absolutely. Well, I mean, on prices, Willie, we're going to see people move towards high deductible health plans. So they're going to have to pay more of their actual gross income before insurance is going to kick in. So underinsured, or some are going to say, you know what, the premiums are just too much, even if it's high deductible, we're going to go uninsured. What does that mean? That means that if you end up, especially in cold and flu season, needing an acute visit, going to urgent care, going to the ER, it's going to be potentially not covered, and that's going to result in delayed diagnosis.
So, Dr. Gupta, one thing that's becoming a sadly familiar headline is the return of some sort of disease we thought we had sort of beaten. South Carolina, now the home of the nation's largest measles outbreak. Talk to us just about how significant this is, what precautions people should be taking as this seems to be growing by the day.
Well, Jonathan, you know, a quarantine, if you're exposed to measles, is 21 days. So if you're a child in a school in Spartanburg, South Carolina, and you're exposed and say you're not protected or vaccinated, 21 days out from school.
Wow.
We're seeing that more and more in places like Spartanburg, other parts of South Carolina, where the vaccine rate is less than 92%, which is the benchmark for herd immunity and to really stamp out a potential outbreak. We're going to see this more, unfortunately, Jonathan. This is going to get worse before it gets better. It's obviously happening as people are congregating for the holidays and spending more time indoors in poorly ventilated places. So I think that's a concern here. Will this get worse? And the impact it's having on children. 21 days out is not insignificant. So that's the big problem outside of just the health consequences here.
Dr. Gupta, you're a pulmonologist, so I want to ask you about this ProPublica report about the EPA relaxing its limits on levels of formaldehyde. Where do we come in contact with that, and how dangerous is this?
Well, you know, for your viewers, formaldehyde basically is everywhere. It's in nail polish, it's in new vehicles, it's in any department store. Basically anything gives off formaldehyde. And what the EPA has done here is they've installed leaders in the chemical industry who have long wanted to relax how much formaldehyde all of us at this table, all of your viewers, inhale. They've relaxed and said, we can all inhale now double the quantity of formaldehyde that previously was the standard. What is the problem there? Formaldehyde is the leading chemical in the ambient environment around us that causes, it's a known carcinogen. That's the problem. It's not something you want to be exposed to.
What's the rationale behind allowing it then?
It's unfortunately, it's business. This is something companies have wanted, chemical companies especially. And so the EPA's charge and mission, Willie, and Mika, is to protect us from environmental hazards. Formaldehyde is number one, you could argue it, and they've just relaxed standards, just like they've done when it comes to tailpipe emissions, just like they've done when it comes to smokestack, just like they've done with the endangerment finding. Greenhouse gases no longer, according to them, actually are harmful to human health. They've said that finding is null and void. So this is the EPA right now.
Great. MS Now medical analyst Dr. Vin Gupta thank you very much for
Thank you.
coming on this morning.
Thanks, Vin.